Hello, everyone, and welcome to MGFA's Wellness Series webinar, Exercise and MG. I'm Jenna Umbalo, and I'm the National Director of Patient Advocacy and Community Engagement at the MGFA. Before we get started, I'd like to go over a few housekeeping items. Please submit your questions via the Zoom Q&A icon located on the Zoom menu bar, and we'll answer them during the Q&A segment. You can submit comments using the comment icon located at the bottom of the Zoom menu bar. Today's session will be recorded and available online. Now I'd like to give special thanks to our sponsors for the Wellness Series, Alexion, Argenx, UCB, and Janssen, Cabaletta Bio, and Horizon. We've got a great presentation today, and now it's my pleasure to introduce our speaker, Dr. Pasnoor. She's a professor in the Department of Neurology at the University of Kansas Medical Center, the Program Director for Neurology Residency Program and Clinical Neurophysiology Fellowship Program, and the Associate Program Director for Neuromuscular Medicine Fellowship. Her practice focuses on neuromuscular diseases, and she has a special interest in myasthenia gravis and neuropathies, in addition to various neuromuscular conditions. Her research focuses on these areas, and she has multiple ongoing trials and publications over the years. In addition to clinical care for patients research, she also is training residents, students, and fellows in neurology and neuromuscular medicine. Dr. Pasnoor, welcome, and I'll hand it over to you.
Thank you, Jenna, for that introduction, and I would like to thank MGFA for giving me this opportunity to talk to you all today. And let me share my screen here. I think, Jenna, I think I'm not able to share my screen.
Are you able to see the icon at the bottom of the Zoom bar that says share?
No, I'm on the share, but it didn't allow me initially, but now I'm able to do it now. Okay.
Oh, perfect.
I think it was. Okay, sounds good. All right. Well, thank you. And these are my disclosures. And I'll be talking about exercise and myasthenia gravis. And none of these will be relevant here. However, so just going on benefits of exercise in general, like all of us know there are a lot of benefits of exercise. There's what happens if someone has a sedentary lifestyle, that is, you're not moving much, you have increased risk of mortality. We know that cardiovascular disease increases, cancer increases, diabetes, etc. So a lot of medical issues if you have a sedentary lifestyles. So what are the benefits of this? I mean, there have been many studies looking at benefits of exercise, like reduction of mortality, like premature mortality, like avoiding like, cardiac disease or chronic medical issues. These can be reduced by about 20 to 30% with the exercise, and about also reduces risk for more than 25 chronic diseases if you exercise. So we know there have been benefits in general. I'm talking about just normal, like any person, if you don't exercise or versus if you exercise, those are the benefits. And going on to specifically myasthenia gravis, as you know, it is a rare autoimmune disease of the neuromuscular junction, and it affects, again, it causes muscle weakness, which includes the eyes, the limbs, the bulbar. When I talk about bulbar, I'm talking about like the speech, the swallowing, you have weakness of the muscles, and there is fatigability that people have with this. And, the first concern people have is, does exercise cause worsening of these symptoms, the fatigability and the generalized weakness? Is it going to get worse if I exercise? Is what I get all the time in my clinic. My patients ask me that. And as the advances, as you know, there's been a lot of advancements in treating myasthenia patients. And with the advances of the treatment, we have noticed that if you look at this graph, the mortality and morbidity has decreased significantly. Like over the years, people are, we are seeing more improvement in mortality and morbidity. However, the prevalence has increased, so there is more awareness of the condition. So even with all this, there has been all these treatments that we have, there's been modest effect on activities of daily living, so people still, I mean, this is another study looking at MG patients and looking at, they just sent a survey, like this was in 1,500 patients in Germany. They sent a survey and asked them, what other symptoms do you have? And if you look at it, there are impairments of muscle strength, physical strain, weakness of the upper limbs, was reported by many people. And if you look at this, they have shown that physical functioning was less in myasthenia gravis patient compared to normal people who do not have myasthenia gravis. I don't mean, and again, they divided by males and females, and across the board, like with males or females with MG, you're seeing decrease in the physical functioning, physical role, bodily pain, I mean, general health, social functioning, all these are like decreased compared to the general population. So looking at this, so we see that despite the treatments are improving, there is prolonged life there has been prolonged life expectancy with the treatments. The quality of life remains reduced in MG patients. Again, can we improve this with other means is what we need to see. So the questions that we'll try to answer during this is there evidence to say that exercise causes harm to MG patients, or can MG patients exercise? What kind of exercise they can do, or will it affect the disease in any way if they exercise? So going back on, just like other autoimmune diseases, MG is an autoimmune disease. So although we don't have a whole lot of information on MG, I'll be presenting some of it. But looking at other autoimmune diseases and exercises, there's lower physical activity than general population. I mean, this is just comparing people with autoimmune diseases and exercise. This physical activity is generally low in people who have, who have autoimmune diseases. And autoimmune diseases also like have higher incidence of physically, less physically active patients. You see more like in rheumatoid arthritis and MS and inflammatory bowel disease and psoriasis. They've seen that patients have they are less physically active than other people who do not have autoimmune conditions. And in these conditions, they've already looked at some studies and established that physical exercise is safe in this, and established exercises as part of, and they have incorporated that exercises in part of the treatment regimen in these conditions. So can we do that in MG is something we need to keep in our mind. And advances in treatment has also led to improved quality of life in those conditions. And we know that exercise, I mean, what does exercise do? So in addition to, improving your strength in general, like for any person, we are just talking about in general, normal people, when we exercise, what happens? There is a rise in some of the inflammatory markers like T regulatory cells, decreased immunoglobulin secretion, and they have seen some changes at the cellular levels, and release of myokine, interleukin, and anti-inflammatory response. So this anti-inflammatory response, so this is all improved with exercise in immune system is what they have noticed. What are other benefits that you notice as a patient? Is improved quality of life, mood improvement, fatigue, reduction of fatigue, and positive effects of cognition and like memory and mobility is improved. For someone who has knee pain, these exercise can improve your mobility and reduce comorbid and cardiovascular conditions, that is your heart conditions. So you can see there are a lot of benefits with exercise in general for anyone. And we'll talk specifically of myasthenia gravis, but that I was talking about just in general. And so neuromuscular diseases and exercise, what do we know about just in general the neuromuscular diseases like muscle inflammation or nerve inflammation? So what we have seen is general fatigue and cardiovascular deconditioning is more common in neuromuscular disease. And I think that's expected. And, because you're weak, you're not exercising much, and then you get more generalized fatigue and cardiovascular deconditioning occurs. So they've noticed that few studies have shown benefit or, in this, and inflammatory muscle disease was studied by one group, and they have noticed that increasing aerobic capacity improves muscle function and reduces disability. And then they looked at patients with neuropathy and inflammation of the nerves. And what they've noticed is an improvement in muscle resistance and functional activity improves, and also looked at patients with muscular dystrophies. And even in this group, they have noticed that exercise does improve chronic fatigue. So you can see all these neuromuscular diseases, there's improvement. And so the other thing is regular exercise. What they have finally established is regular exercise is beneficial in this. Aerobic exercise or strength or resistant exercises, both are equally, both are effective. And it's important to establish an exercise program with physicians and patients with, going to patients with neuromuscular junction disorders or metabolic myopathies. Again, they suggested maybe combining strength training, submaximal aerobic exercise, and slow increase of repetitions. And these I'll be talking a little more as we go along. But overall, they've seen that with any muscle disease, there is benefits of exercise in this. So just before we jump into the, myasthenia gravis and exercise, we talked about some other autoimmune conditions. We talked about muscle diseases and having exercise. So all of them are showing some positive beneficial effect. Now going on to the types of exercise, aerobic exercises are something that you would use your oxygen to do these kind of exercises. These are performed by repeating sequences like jogging, walking, running, stair climbing. These are all, energy generating process and aerobic energy generating process. So that's the examples of that. What are resistive exercises? These are, again, I'm sure most of you are already familiar with. They can be mechanical or manual. That is when you're using weights, or when you're using like a clinician or a physical therapist is like holding on to that and the legs, or holding and helping you out with that. This is when the muscle contraction is opposed by force, so some force is opposing you what you're doing. And that's there are different kinds of resistive exercises. So some of this I just put here, like using bands and trying to move your legs or move your arms, or trying to pull up your foot. Or you can do lifting weights. These are all resistive exercises. And again, they've noticed that it improves muscle tone, muscle strength, weight management, cognition is improved. So there are a lot of benefits. Again, just wanted to show a cartoon, and opening and closing a door, fridge door 50 times a day may not always qualify for an exercise. And, so it also, one of the other benefits we have seen with exercise is reducing risk of osteoporosis and improving well-being, overall well-being in patients. And so going on to myasthenia gravis. So this was, we talked about in general exercise, the different types of exercises, and in muscle diseases and other autoimmune conditions. And now I'll be focusing on just myasthenia gravis. And what is, the first thing is, people complain of fatigue, and fatigue is very common in myasthenic patients, and we all know that. And I hear that from all the patients. And when they come in, what is fatigue? I mean, sometimes it's the extreme tiredness resulting from mental or physical exertion or illness. That's what you would see in a dictionary. And when the people come in, they say, like, I feel tired or exhausted with even minimal activities. And there's a performance decline during prolonged cognitive and physical activities. And or it's in like an objective decline in strength. That is when you're doing some repeated activities, you feel there's a decline in the strength. This is all, various explanations. What happens at the neuromuscular junction, that is, the nerve and muscle junction, what you see is the transmission of response is decreased and muscle weakness occurs. Physical exhaustion and tiredness comes in. There are various causes for muscle, fatigue. Again, it could be physical inactivity. Sometimes, if you don't exercise much, also you can get fatigue. And disease severity, like if you're more severe disease, you can get it. Or someone who's depressed can get fatigue. Someone who has, again, the quality of life may affect and cause fatigue, and muscle wasting can cause fatigue, comorbidity. So a lot of things can lead to lethargy and and fatigue in in myasthenics or in general for people. So this is, these are all the things that can cause. So routine MG score, and when we're talking about MG score, we're talking about like some of the outcomes that we measure in the clinic. And I think most of you might have had a repetitive nerve stimulation, that is repeated stimulation of the nerves to test. That's one of the ways we test for fatiguing of the muscle when we give repeated stimulation, and then we are seeing if the muscle fatigues out. And these are suboptimal for like sometimes for proximal. I mean, when we test mostly distal muscle. We don't test the proximal muscle. So sometimes, we may not be doing we were unable to do the proximal muscle. So, but what you're feeling could be a proximal muscle weakness. So they may not always correlate with the repetitive nerve stimulation or the MG score. Persistence of fatigue in patients with stable, long-standing generalized disease who lack fatigability, like, when we test you in the clinic, we may not actually see a fatigue or, we may not identify a fatigue in clinic. So that's some of the limitations of, doing an exercise study. And QMG and, quantitative muscle test and repetitive nerve stimulation may not be sensitive to capture fatigability in long-standing generalized disease. So there have been various outcome measures. So first is, how do we measure fatigue? That's the question which comes up. And, when patient tells me like I have fatigue, if you do a repetitive nerve stimulation, I may not be able to figure that out on that. So some of the measures that have been used are fatigue severity scale, as I showed here. There are, we ask people like, my motivation is low when I'm fatigued, exercise brings on my fatigue. There are 9 questions here, and this has been commonly used in trials. So first is, before we do an exercise study, we need to know what to look for. What is the outcome? How do I measure the fatigue? And this is something that most of the studies have been using, is the fatigue severity scale. And the other things that you can do is like 6-minute walk, like making a person walk for 6 minutes and see how far they can go in 6 minutes. And that also tells us like, okay, if you see now and it's say it is 2 meters or 3 meters, and then next time when you come in, because of the fatigue, it's low. That gives us a good sense of what it looks like in the fatigue, or what's the change. And people have done a modified one with 2-minute walk. And difficulty in practically measuring oxygen consumption in clinical setting, that's another. I mean, you can do a oxygen consumption testing, but even that is difficult. And there are other confounding factors to test fatigue, is like, people who are on steroids can have fatigue, or people who are on other medications, those can also cause fatigue. So it's hard to measure that sometimes. And going on to the baseline characteristics of MG. So patients, when they looked at MG patients versus healthy individuals, they, just like we saw in other autoimmune conditions, MG patients are less physically active is what we have noticed overall. Again, it could be due to the weakness with the muscle, or it could be the perception that, again, or the medications. So anything, but overall, when they looked at people with MG and healthy individuals, they said they were less physically active and more often sedentary. And, this is something we need to work on. And, maybe we can improve some of the, fatigue with this too. They looked at MG composite score, did not correlate, which is one of the things that we use for to measure outcome measure for treatment trials. But this does not always correlate with the physical activity, so it's hard to measure with that. So one study, what they did was they looked at the arm movement, like moving your arm, and 6-minute walk test in 32 patients, MG patients, and compared it with 17 controls. And they did see that there is a gradual decrease in performance. Physical exercise in myasthenia gravis was the objective parameter of fatigability, and 2 out of 32 patients had mild decrement on the nerve test, but most of them did not have a decrement on that. Just the perception of fatigue was very high in MG patients controlled compared to the control subject as controls, that is the other people who did not have MG. And they did not see a correlation between the subjective fatigue parameters and objective results from, multifactorial etiology of fatigue. And they also considered like psychological and lifestyle factors in patients instead of increasing, instead of increasing like your medications, maybe working on psychological or lifestyle factors, maybe that will help with some of the fatigue, so it's not always the medication that helps with fatigue. And that's why, we are looking at even thinking of exercise, maybe that will help with the MG. In this study by Ferrugia, what they did was they looked at 9 patients with a 10-week program of not just muscle stretching exercises, but breathing and relaxing exercises. So both psychological as well as physical activity. So they had both approaches, psychological and physical approach. And what they saw was that there was slight improvement in physical and psychological subscale, that is the modified fatigue scale improved, significant improvement in the visual analog fatigue scale. So they did see a significant improvement, no improvement in fatigue severity scale, but there were some which were improved. Some we didn't see much improvement, but overall fatigue scores returned to baseline 3 months after the study. So if you don't continue, they can come back to baseline if you don't continue that. Muscular adapt. So what happens? Why do we need to do exercise? Why do we need the exercise? What happens if you don't exercise? So with muscle exercise, usually with strength training, the muscle becomes, you can get hypertrophy of the muscle. As you would see in athletes, their muscles look bigger because with 6 to 8 weeks of activity, you'll see muscle fiber hypertrophy. There's increased protein synthesis in about 6 to 8 weeks after after you start exercising. And then there are also other changes, like you'll see changes in the nerves, and there's neural adaptation and increased activation of the motor nerves. So you see there is more I would say more activity of the muscles because of the nerve changes. And they also noticed that, if there is neural adaptation of one limb that you're exercising, that also causes some increased strength in the other contralateral limb, is what they have noticed with some of these exercises. So basically, these are the benefits of exercise in general in muscles. And what are the limitations of doing a trial in myasthenia gravis? There is always some issues, why we are not able to do in MG patients, because most of the studies they've done are relatively short, and the follow-up periods could be just like 3 months, or so we don't have like a very long study to say are they beneficial or not. And usually if you have a long study, again, people tend to drop out. They do not want to continue the exercises, and it can be time consuming, coming to the place to exercise, or coming to the, where the exercise study is going on. A control group is, we'd like to have a control group that is someone who doesn't have MG, but that is also very challenging to get them here and do the exercises, and difficulty to double blind patients. That is, it'll be hard for me to not know like whether the patient is exercising or not. And so it's difficult to blind. If we want to do like a placebo control trial, it's very hard to do that with exercise. So these are some of the difficulties in like doing a exercise trial. So due to fluctuating muscle nature of the muscle weakness, it's hard to quantify, like, because you may be normal when you came into exercise, but you may have fatigue later on. So these are difficult to quantify sometimes. And so these are all things that have been caused difficulty in coming up with exercise. And the other things is most of the myasthenia patients are on corticosteroids or have weight gain due to this, or osteoporosis, and they cannot exercise because of that, or they have diabetes or have muscle weakness. And but in general, exercise might be beneficial even to improve all of these side effects. And pyridostigmine, does it have any effect? It can cause bradycardia, that is like slowing of your heart rate. However, it doesn't contraindicate, it doesn't prevent you from exercises. What about other immunosuppressive medications like Imuran or Cellcept or other medications? Those also, there are no side effects, no contraindications for exercises. And in general, with normal aging, no specific studies for elderly or specific exercises, for normal aging. This is just to show you, again, I know it's small print. I don't expect you to read all of it. But these are some of the studies that have been listed that have been done in the last few years. I mean, I would say over the years, that have been done in myasthenia gravis patients, and looking at exercise intervention, and would that help? I don't want you to be reading through all of it, but most of the studies were, the sessions were over 8 weeks or 12 weeks. Only one of them was like about 3 months, and this one was like 10 weeks. So I wouldn't say these are long studies, but they were enough to get some answers. And participants, we had, you have seen that, I mean, basically these are, some of them had arm exercises as well as the leg exercises, and some of them balance training, so you can see this varied type of exercises. And overall, we have noticed that exercise is feasible for most patients with mild MG, over 90% adherence. I mean, because in this study, 90% of the patients were, did continue to participate in this, and they noticed that the oxygen level and oxygen saturations and oxygen, the VO2 max was stable in these patients. And MG QOL scores in AT group, some deterioration in that. However, improved knee extensor, shoulder abductor strength. So they have noticed overall like improvement in some of the strength. All patients completed the program in this study, and again, they have noticed some improved 6-minute walk test, and so other factors, so there's no clinical MG deterioration in this. So they also showed that they were by Dr. Westerberg, again, they have shown that it is, there's no clinical deterioration of MG, and people can participate in exercise. And 10, they have increased resistant weights or on 4 or 7 strength exercises. So you see that overall they have some improvement there. And again, this study also showed improvement in maximal voluntary muscle force compared to 4% of untrained side. And so you can see that overall, like, most of these studies have shown that patients can continue doing the exercises, as well as there's some improvement in the exercises. So these are some other studies that are, again, some of them have been completed, but I couldn't find the results on them yet. And I'm hoping that we'll see some of the results. But one of them is the MEGEX study, which is the MG exercise study, where they randomized people into single blind 2-arm parallel study, which is like they took 42 patients, and they did a 3-month observation, like followed them 3 months, and then randomized them into either the exercise group or the non-exercise group. And they looked at whether they had improvement or not. And they are looking at, the primary outcome was the quality of life, and they're seeing if the quality of life improves after after the exercises. 14 minutes home-based exercises for 3 weeks, and total of 3 times weekly for total of 3 months. And they're going to be looking at this. I didn't see the results of this, but they are looking at other outcome measures also, secondary outcome measures in this. So we'll get some answers from that. The other one, this one was published in 2013, and this was published by Dr. Charlene Haffer-Mako, and they looked at 7 patients. They did 3-month intervention of aerobic, breathing, and resistant exercise training. And what they showed was that this is well tolerated by the patients and safely produced 4-fold in higher workload capacity. So they were able to do more, and fitness and functional gains from this are promising. And so they we're planning on a larger trial, which exercise for this one is a trial by Charlene. Again, they are doing phase 1 open label, plan to enroll 30 patients, 3 months exercise. And the primary outcome is looking at safety and benefits of cardiovascular fitness, gait, and physiological. So they're looking at different measures, not just, whether this is feasible or not, but also looking at the safety of patients, with MG. And the patients will be undergoing aerobic, resistant, and breathing exercises. And you have seen, like in the previous one that I showed, is the pilot of that study. And this is the extension that we are looking at. So in general, now we know with all those studies that it is safe, it can be done, and it might have some positive benefits. And this is another looking at thymectomy and exercise. Patients with thymectomy, this is a study that they looked at 46 MG patients who underwent thymectomy, who had pre and post operative rehab programs, that is exercises before and after. The exercises included aerobic training, mild resistive training, and pulmonary rehabilitation. And what they noticed was people who received this had overall reduced operative risk. They had decreased early operative morbidity, and that is, they have better outcomes, I would say, lower rates of admission to intensive care, shorter hospital stay, and measures of disease activity like QMG, 6-minute walk test. These all measured a significantly faster recovery at 3 months. But I mean, again, it didn't really tell us that people are going to go into remission. However, the other things have improved, the operative risk and the associated with the operation that has improved if you do pre and post. So in general, like, people undergoing thymectomy, exercise is not a contraindication, and rehab can be safely performed, like exercises after surgery, and operative risk can be reduced with this. So overall, it's good. And even with people who are undergoing thymectomy, before and after exercises are good for overall outcomes. And what about sports and MG? I mean, can patients participate in sports? Again, there's not much of information. I mean, there's limited information in this area, and there's no clear guidelines for athletes for MG. However, they have, like, I'll be showing in the next slide, there are 4 case reports exist on athletes with MG. And then there is an additional one with a 29-year-old who had MG as well as McArdle's disease, and had low to moderate intense aerobic exercise training every day. And she had a significant improvement in her exercise capacity and was able to live independently, regain the ability to live independently after the exercise training. And if you look at these 4 case reports that have been presented, one was a 36-year-old, another one was 17-year-old, a 26-year-old, 15-year-old, who, I mean, again, they were in different kinds of sports. One of them was a marathon runner. This was an ultra marathon runner. And then you have like other kinds of programs. And this patient is in basketball, weightlifting athlete. And they have shown that overall, like, stable MG status in the first one. They discontinued azathioprine, normal respiratory function, stable limb strength in knee after doing all this training, train 5 to 10 kilometers weekly, runs during the first 2 years after MG onset. And another patient also, they showed fluctuating leg weakness, dysphagia, all these during subsided with rest or pyridostigmine. When they were exercising, they had some of these symptoms, but they improved after rest or pyridostigmine. And in this patient, they have shown increased body weight, increased fat-free mass, increased peak strength for leg extension and leg flexion with 15-week resistive training. So you can see overall that there is some improvement there might be some fatigue in some of them. However, even that improved after rest. So is it feasible for people to participate in or can they participate in sports? Well, these 4 case reports, again, we may need a larger, more studies in this area to say, how safe it is. However, based on these 4 studies, 4 patients, it looks like, there is some benefit, and also it is patients can participate in, sports. Again, MG with the respiratory muscles. As you all know that it also affects the diaphragm and other respiratory muscles here. So weakness of the diaphragm, that restrictive spirometry, decremental respiratory volumes during maximal voluntary ventilation can occur. And some people have obstructive spirometry. That's like, when they do the breathing test. These are when they do the breathing test, you see there is changes in MG patients versus normal people who do not have respiratory problems. And dyspnea on effort can occur. That is like shortness of breath when you exert, or impaired physical activity because of getting out of breath. These all can occur in myasthenic patients. And so but however, do exercises help? And one study has shown that there is benefits of breathing exercises for myasthenic patients. There is some evidence of that. And going on to some of the studies, there were, they looked at 28. In this study, they looked at 28 patients with generalized myasthenia gravis and looked at MGFA class 2 to, I mean, they were, I would say moderate, mild to moderate MG, and they tested the 6-minute walk test, pulmonary function test, that's the respiration test, and the respiratory strength and endurance. And nearly 40% of the patient had expiratory muscle strength below the lower limit of normal for other people who did not have MG. So you can see in general, they have lower respiratory parameters and multiple, that is, from the weakness of the respiratory muscles, we see there is a difference between normal people and people with MG. So what can we do with this? I mean, when they did a cross-sectional trial, showed that expiratory muscles, that when they did a trial looking at functional exercise capacity improving with the exercises, they have noticed that you can improve the expiratory muscle strength. And this was shown in one of these studies. And another study also showed that training and control, compared to the 8-week, I mean, they did like 8 weeks of intervention. The intervention was training the diaphragm breathing, like, breathing exercises for the diaphragm and through pursed lips, that is like closing your lips and trying to breathe in and breathe out. With this, what they tried to do was improve the diaphragm strength. And when they looked at compared with the baseline of the patient, as well as comparing with controls that who did not get the exercise but had MG, they noticed improvement of the respiratory muscle endurance. So they have noticed improvement in the muscle strength, improvement of the maximal inspiratory and expiratory pressures. That is, taking a deep breath in, deep breath out. They've noticed that there is improvement in that. And also like the thoracic, that is, the mid back, they have noticed more improvement in the movement of this muscles there. So you can see with the respiratory training, that is, just like you would exercise your muscles of the arms and legs, exercising the diaphragmatic muscles can also improve some of your, I mean, they've noticed that in this MG patients, you can improve some of the respiratory parameters, that is your breathing parameters. And another study looking at mild to moderate MG, these are smaller studies, and they have noticed that there is benefit of long-term respiratory muscle training, and on the lung function and also with the respiratory endurance. So you can see that, with just like you would exercise with other muscles, even if you exercise the respiratory muscles, we can improve some of the strength and, respiratory parameters. So what about speech? Again, this is one of the things that is affected in myasthenia gravis. And can we improve speech with exercises? Again, we don't have enough evidence at this point to say that we can exercise the muscles of the tongue and muscles of, that help us with the speech. There was only one case report in literature of patient who had dysphonia and showed some benefit after speech therapy, like improved voice quality, impact on quality of life, is what we have noticed with that. However, it's only one case report, so we can't generalize that. So we need probably more tests to say that it would actually help with the exercises. So overall, this is a study that looked at again, a review actually, looking at all the exercise studies and in myasthenia gravis, and they put it all together and reviewed. And this one was published in 2020. It was just recently published. And they looked at 10 intervention studies, 10 studies that they could find in literature. That is 10 studies that looked at exercise in myasthenia gravis, and total of 159 patients. And 3 of them also had respiratory muscle exercises, not just the generalized exercises. But overall, what they noticed with exercises in this group is the muscle strength improved in most of these patients, daily function and quality of life improved in most of these patients, and the feeling of fatigue is not always directly related to the actual muscle weakness. That is, you may tell your physician that you have fatigue. It may not always correlate with the weakness when we examine you, but continuous training was necessary and to maintain the improved. So it's not like we give you exercise for, you do exercise for just 3 weeks and say, oh, I'm not improving. You want to continue it. You may have initial improvement, and then you want to continue it, and to maintain that improved function. And the type and intensity of the system, and this is very important, it is individualized. Again, I wouldn't suggest someone who has like difficulty breathing, like severe difficulty breathing, to go and start exercising. You want to individualize. So that's what all these studies say. Each individual person is different, and as you all know, MG, everyone has a different are different. Even in the MG group, some people have severe symptoms, some people have mild symptoms, some people have moderate symptoms, some have respiratory problems, some have only weakness in the arms and legs. So we have to adapt the exercise training to each individual patient. It's different for individual patient. A minimum of 150, what they suggested was a minimum of 150 minutes of exercise per week. And in myasthenia gravis with mild to moderate disease is good, is what they suggested. So in conclusion, these last few slides, exercise is useful to prevent many chronic disease, and including, and even in MG patients, not just in other, people who do not have MG, it's good, but even in MG patients, to prevent the chronic diseases like your cardiac disease or kidney disease or other disease, it's better to, it is good to exercise. But there's, although we have some evidence, but literature is still limited. We might need more answers with the other exercise studies that are ongoing to say how much beneficial. Most of the studies are in favor of benefits that we have seen up till now, benefits of exercise in MG, and clinically stable MG patients, similar to healthy individuals, should be able to gain the benefits of this. And like I mentioned earlier, 150 minutes of moderate exercise per week would be useful. And those are the kind of recommendations right now. And patients should always contact your physician. Again, I know I say 150 minutes is good, but it's always good to talk to your physician who's treating you for myasthenia gravis before you start any kind of exercise program. Again, because your physician knows you well, and they also know what your symptoms are like, and what would help you the most. And where should we focus our, from here, where do we go? What extent of physical exercise should form part of the routine treatment? Like we all treat patients with steroids, we treat with, all the immunosuppressive medications, we treat with pyridostigmine, so we treat with all these medications. But the question is, should we include some exercise regimen into this treatment along with the treatment? That's something which we need to, I think, as a physician, also me and others should consider that, just like in, arthritis, that's, it became a routine to treat patients with exercise along with that. So specific training protocols of particular benefit to individuals with MG, and establish tailored training recommendations. Like I mentioned, each individual patient is different, and we need to make sure that we have, individualized for each patient. And there should be, we don't have a consensus at this point, like how do we measure fatigue? How do we measure the physical performance in clinical trials? These are some things that we need more work on. And, what are the, these are the things that we need to focus on disease activity as well as quality of life, physical performance, like, when you exercise, how much exercise, or what are you able to do in a day-to-day, like, in your daily activities. Some maybe say, like, I'm not able to, I was able to cook and stand and wash dishes, and now I'm not able to do that. Some of these we can measure it in the clinic, and we need more of those outcome measures. And, like for fatigue and for measures of physical and mental fatigue is also, some things that we need to work on. And to improve the impact of such studies, the recommended MG outcome measures for clinical trials should be used for now, like the MG-ADL, which is already, we know that, and we use it in many studies. That's the activities of daily living. As you all know, when you come into the clinic, we ask you, are you able to, like, do you have double vision in the last week? Are you able to lift your arm up? And are you able to comb your hair? These are some of the things that we ask. Maybe we need more than that, but you can correlate with the MG outcomes. So finally, I'd like to say, with all this, that have presented up till now, so we talked about, like, in general, what the benefits of exercise are, and then we talked about how it affects in other autoimmune diseases, and what evidence do we have, how it would improve. And then we talked about the muscle disease and how it helps in various muscle diseases and nerve diseases. And then in myasthenia gravis, we have seen that whatever evidence we have up till now, when patients are stable and well controlled, MG patients can be encouraged to have, do exercises. Again, if you are having a crisis or if you're having an exacerbation, I wouldn't suggest these exercises at that point, but if you're stable and you've been on the medications and, now you're stable, well controlled, this would be good time to start off an exercise program. And it's always important to be active and reduce overall sedentary time. What do I mean by sedentary time? The time that you spend sitting down and not doing anything, that would be your sedentary time. You want to improve that, and it could be like just 1 or 2 minutes standing up, or or walking outside, or just don't be sitting for too long, or sedentary for too long. So these are important things to remember. And I think that's the last slide I have, and I'm open to any questions people have regarding exercise, or, let me see what we have here in.
Thank you. We have quite a few questions that came in. So the first one that we wanted to cover was, how do you feel about pool exercises rather than land-based?
That's an excellent question. And so as long as you're not having, it's usually, that's something which I recommend for my patients who have difficulty with back pain or balance issues. It's really good. And even with MG patients, I don't see any problem unless you're having difficulty breathing. I mean, that's something which I wouldn't recommend if you're having difficulty breathing. But otherwise, I think it's a good form of exercise, even for MG patients. It's definitely a good form of exercise.
Thank you. This next one is, what has been your findings or recommendations for exercise for moderate MG that prevents being able to engage in PT, as well as participating in PT worsens MG symptoms?
I'm sorry, can you repeat that, Jenna, again?
Sure. Yeah, it's a long one. What has been your findings or recommendations for exercise for moderate MG that prevents being able to engage in PT, as well as when participating in PT, it worsens MG symptoms?
So, most of the people do have fatigue, and it's part of MG. We understand that, again, and it could be subjective or it could be objective. What I mean by subjective is like when you exercise, you feel that you're fatigued, but when we examine the strength may be normal. So what I tell my patients at least is, if you're feeling, if you're having, the fatigue, just give it, maybe take a 10-minute break and then restart again, but if you're having significant weakness, you're having weakness in the arms or legs and not able to do that, that's something which, definitely I would say see your physician before you restart the exercise. I wouldn't recommend that at that point. But if it is mild fatigue and with like 5 minutes rest, you're getting better, then I would suggest like taking a rest and restarting your exercise again. And I always tell my patient, you don't have to do like a continuous, like, an hour of running on the treadmill, or, it could be like 10-minute break and do another one, or 5-minute break and, do again, so I would recommend like that would be my suggestion, would be like, take some breaks if you're having weakness. And that's what I would suggest with that.
Thanks. Have any studies been done using blood flow restriction, BFR training for MG patients?
I don't think I've seen that. Not that to my knowledge. So I'm thinking you're talking about when you said VFR, or I didn't get the second part, but the first one, blood flow studies. I haven't seen that, the blood flow studies, but what was the
So it was just blood flow restriction, BFR abbreviated.
Yeah, I didn't see. The VO2 max has been with the respiratory has been looked at, but I haven't seen studies that specifically looked at the blood flow in the patients.
Okay. This next question is, what type of respiratory or diaphragmatic exercises are helpful?
So, as you've seen in one of the studies, they have done more like breathing exercises with the pursed lips, more like Valsalva, I would say, is what they did to help with so they close their mouth and, taking a deep breath in, and some of these actually, like even like closing the nose, one nostril, and like, I don't know if you've noticed some of the yoga exercise, like taking in deep breath in, expirating and, and holding it for some time and then breathing out. These are some of the exercises that should help with the diaphragmatic exercises, as well as increasing the capacity of your lungs. These are general exercises that you would do even if you didn't have myasthenia gravis. I think that similar exercises should help even with people with myasthenia gravis. Again, like I said, if you're having difficulty breathing, that's something I would first talk to your doctor before you start doing these exercises. And but if you slowly increase your capacity, again, your lung capacity can improve if you do those deep breathing exercises with there's just like, holding one nostril, taking a deep air, holding it, and then, you probably would notice some of the yoga videos online. You can get that also for these breathing exercises. And it helps with not just the intercostal muscles, but also the diaphragmatic muscles. It helps with that.
Great. Has exercise ever been associated with remission?
No, and we pointed that out. Actually, in fact, it did not correlate with remission. Even in the respiratory, in some of the studies have mentioned there's been no correlation. In fact, actually, this even with the clinical outcome measures, we haven't seen a clear correlation with that. It's more, again, we have seen the respiratory function with some of the other parameters like fatigue scale and overall mood, and, decreasing so not clearly like, I wouldn't say that your myasthenic symptoms would improve just with the exercises. The exercises would prevent you from getting deconditioned and getting, some of the, if you don't exercise, you're going to get deconditioned. So you're trying to keep yourself active so that you don't get deconditioned from having myasthenia gravis. So that should be your goal.
This next question is, what is your take on getting a massage?
I don't think there's any contraindication to that. Feels good. If it feels good, it's okay. As long as, again, with COVID, I know we had a lot of restrictions of, being out or being exposed to other people. But, again, if it's not hurting, I don't have any restrictions on that, on massage, as long as um, you follow your precautions.
Thank you. This next one is, I have started Pilates and my MG is stable. Do you agree with this type of exercise?
Yeah, I mean, if you're stable, any form of exercise that you're able to tolerate is fine. I don't see any problem with doing that exercise in any form of, any form of exercise is okay. If you're stable.
Yeah.
And again, I want to add here, I'm sorry, Jenna, and I interrupted there, but if I would always suggest, like, also talking to your doctor before you do any form of exercise, because again, I can be giving these suggestions to you, but I don't know exactly how severe your disease is, or how how well controlled your disease is. So I would suggest, like, always discussing first with your doctor before you start any form of exercise, and make sure that they are okay with that before you jump into doing more these exercises.
Yeah. This next one is, what are normal FEV1 and FVC levels and ratios?
So these are the, when we look at, these are the respiratory parameters. Again, these are when the taking in the inspiratory and expiratory, like, when you take a deep breath in, we are looking at humus, so these are the volumes that we are testing when you're, I don't know if your physician has done that, but when you come into the clinic, sometimes we ask you to blow into this spirometer, and we measure what your lung volumes are. So this is the forced expiratory, that is when you're breathing out, we're looking at what your volumes are. So that's what the FEV1 and V is the ratios, and that we calculate. It's all what we measure with your lung volumes, basically.
Great, thanks. Does any of your information reflect specifically seronegative generalized myasthenia gravis patients?
That is a good question, but I have to say, no, I don't have specific information that this is like seronegative, or again, the seronegative is a smaller group among the myasthenia gravis, so it would be very difficult to do specific studies in that group by itself. In general, myasthenia gravis is such a rare condition, and just doing in a subpopulation would be very difficult. So I don't think any of this is, but I haven't looked at in detail to see if there is, if they included seronegative myasthenia gravis patients or not in this group.
Okay. Do you have any recommendations for people who suffer with vision issues due to their MG for ways that they can safely exercise?
Can you repeat that again, Jenna?
Yeah, recommendations for people with vision issues as a result of their MG for ways that they can safely exercise.
Yeah, so definitely, I mean, even if you have vision issues, I don't see any problem with doing like resistive exercises. I know it would be difficult to walk outside, or are you talking about like, I mean, it may not be exercising your facial muscle, I mean, your eye muscles, but you can definitely do like the rest of your body. Like you can do your resistive exercises of the legs, your arms, you can continue with that. But if you're asking specifically for the eyes, I don't know if there's any specific exercises that I would recommend.
Okay, I think it was more about exercise in general, like safe,
Yeah, so
safe
exercise,
movements.
Yeah, exercise in general, I mean, if for aerobic exercises, I know you need to have a good vision. You don't want to have double vision when you're running on a treadmill and tend to fall, or, when you're outside walking, or, it might be difficult. But if you're doing resistive exercises with weights, or, something in the legs, that might, again, you have to be careful with weights also, but, you can basically exercise anything with sitting down, or something that doesn't involve you falling over, or that should be fine to do.
Thank you. We'll do one more question real quick, and it's, are there any nutritional supplement recommendations? COQ10, for example.
So no, actually, MG, there's been studies. Many studies have looked at, can nutritional supplements help with MG in general, and there hasn't been any specific recommendations on like nutrition factors affecting MG. So in general, I wouldn't say that it makes, or I mean, it helps in any way. And CoQ10 has been tried in other muscle diseases. And again, there hasn't been any difference, especially in like mitochondrial muscle diseases and other things, but not in MG. We haven't seen any specific benefit that I know of, at least.
Thank you. That's all the time we have for today. Dr. Passner, thank you so much for your time and for sharing this information with us. Just a reminder, this recording will be available on the MGFA website. If you want, you can subscribe and be on our email list so that you get notified when all of these Wellness Series webinars occur. I hope that you guys have a great rest of your day, and we look forward to talking to you soon. Thank you.
Thank you, Jenna. Thank you all for listening today. Bye.